Good morning. This is Dr. Timothy Scott Beck. It is Tuesday, September the 6th, 2022, and thank you for listening to me today. I hope you enjoyed your vacation yesterday or holiday. It was Labor Day, and of course, we celebrated Labor Day by taking the day off. But we had a good, safe weekend, and I hope you did too. However, we are been wet for several days now. Feels like we're just soaking wet all the time. Even when you walk outside, it's very, very humid. I guess you know that, right? Okay, let's get right down to business about things going on. First of all, COVID-19. We're still seeing maybe 10 or 15 patients a week with COVID-19. The good news is it appears as if most people have a cold, a severe cold. We still got our protocols in place if we think you're symptomatic, just to minimize exposure here to the clinic. Okay, so be mindful of that. We're trying to do the right thing to keep the patient safe and get you taken care of. So if you think you got COVID, or you've been exposed to COVID, please let us know, and we will get you accommodated and do it in a safe manner. Next thing, I just want to put out a general warning, and this is, I don't know how to say this exactly, but I've had some people in the office who are getting a drug screen, and they're showing up with fentanyl in their blood, and they don't know where it comes from. Now, there's a lot of issues with this story because a lot of, sometimes I know people use illegal drugs here in the community, and it's an extremely dangerous habit. A lot of people know what they're doing, or they think they do. However, I will tell you that this fentanyl is a game changer when it comes to the danger level when it comes to any of these drugs. Okay, and I don't condone the use of any of them, but I just want to let everybody know that people are complaining to me when I find fentanyl in their blood that they don't know where it came from. So I want you to be extremely careful. Even I've got my kids now. There was a $5 bill on the ground the other day, and they left it alone. They didn't touch it because I know I've seen news reports of these leaving money or something else around with it tainted with fentanyl, and it's extremely difficult to manage after you get exposed, and it's extremely lethal and potent with some of the chemicals they got coming out with that. So I think a general concern about all that is a very good idea, and just be very vigilant with yourself and with your kids. Okay, we know that's infiltrated the country. We know it's everywhere. I hadn't seen it pop up, but I'm actually seeing it pop up now, and it's extremely worrisome to me. So just keep that in mind. Another issue, it's almost a daily issue here with us, and I can't emphasize much how important this is. And and I know how disruptive it is. I know nobody wants to bring their meds to the office visit. I know that. They want to bring a list, or they want to do something else, or they want to call the pharmacy while you're here. And I'm telling you, we can't do that. We need to see what you're on. So bring your meds to the office, and 100% of the people who don't bring their meds have a med issue that requires more work from them and from us to figure out what's going on. And even when we're just sat there and said, hey, please bring your meds, they will not bring their meds, and they will have an issue specifically related to your meds. So look, it's about you first and foremost. Okay, if there is a medication error and we didn't do our part by demanding that you bring your meds in, then it's on us. Okay, but if we're begging you to bring your meds in and there's a medication error, that's not a good thing, and we're just trying to prevent that. Okay, and it is inevitable that happens. So I just want to remind you and beg you to do that, and I think it's a good idea. You would never go to a dealership and tell them your car's not running without your car there, or expect them to know what to do for you without your car there. And that's kind of the way I see it with the medications. That's what I work on. It's the tools that I use. So just help us out there. I know it's inconvenient. Take your bottles. If you put in one of those regular pill counters, take your bottles and just put them in a bag and say, when I go see Dr. Beck, I got to take this bag with me because he needs to know exactly what I'm on. So it's just an easy safety issue. Okay. So let's talk about Thursday night as Place of Hope, Picnic for a Purpose. I checked last week and they only had 2 tickets left. I'm pretty sure they don't have any more left at this time, and I'm greatly appreciative of all the people who's participated in that and actually who are corporate sponsors and everything like that. The house is up and running now, and we will be talking about that aspect of our business at the picnic, as well as thanking everybody for their great support. So again, lots and lots of people who are listening to this video were very supportive in getting that going, and I want to say thank you personally for that. Thank you so much. All right, we've got a little short week here because it's Tuesday, but we still want to see you and we want to get you taken care of. Our number is 706-782-0016. Give us a call. We do have a new phone system, so it should have made leaving a message easier. Not sure if it's working quite the way we want it to yet, but I'm going to be testing it out this week and trying to get it so that it's the easiest and most user-friendly for you, the patient. Thank you so much for listening to me. You have a great day. Call us if you need us. Thank you.